So the new Abbott test, are we going to get that at Kaweah Delta?
Yeah, so I'll apologize, I'm going to take a little bit longer with this because it's not just Abbott.
Okay.
So initially, and to date, we've only been a specimen collection facility. We don't actually do the testing to determine if it's positive or negative. So we collect the specimen in a special kit and we send it to the county lab located in Tulare, and they've been performing all of the tests. A couple weeks ago, 2 commercial labs entered into the picture, Quest and LabCorp. And so they're doing testing as well. We pretty much have been using the county. Last week, we were working with a company, a national laboratory called BDX. And we are a BDX customer. And we have their lab analyzers. We have their platform. So BDX sent us a kit, one kit. We asked for 50 of them, but we got one. And that one kit had about 220 test kits inside of it. And now the testing kit is actually the reagent that you use to now test because when you swab a patient, collecting the specimen, you then put it in saline and creates a mixture. And it's that mixture that you then put in the lab analyzer to test for the virus. So we got this kit from BDX that allowed us to do 220 tests. The first thing that we needed to do, though, is to validate that the test was accurate. And so we received 20 samples from the county. They sent us 10 that they'd already tested as positive and 10 that tested as negative. And so we now rerun those tests on our BDX platform. That's the validation process. Unfortunately, we burned through almost 200 of those tests to complete the full validation because of just the integrity of the specimens and just, you want to be, because if you're going to make decisions based on those test results, how you're going to treat a patient or you're going to discharge them home, you want to be highly confident that those test results are reliable. So we finally got through that process, which left us about 20 remaining tests. And so we have actually been doing some testing for our inpatients that we are suspicious of and that we need results quickly. So we're using those, but we've been unsuccessful getting additional kits, testing kits from BDX. So that's on that platform. Separate from that, we've all heard that Abbott Laboratory is also a very well-known national laboratory, has purportedly developed a test that allows the Abbott analyzer to produce positive results in 5 minutes or negative results within 13 minutes. We, Kaweah Delta, are a very large, important customer of Abbott. We have 38 of their analyzers on site here. And so Randy Coca, our Director of Laboratory Services, and Dr. David Hewitt, who's our Medical Director of the lab, are on the phone almost all day long with Abbott and their senior executives trying to secure the testing material for us to be able to do it. And so far, we've come up empty. Very, very frustrating because we are ready. We have that testing capability, and it could have a profound effect on our use of PPE, because if we can rule out, if we know somebody's not negative, that changes entirely. We don't put them in isolation. Or if they test positive and we know those results in 5 minutes, that's going to influence the kind of care and how we're going to take care of that patient. And so right now we continue to use the county, and again, I want to commend the county that the results are coming in more and more rapidly, generally within 24 hours, but that's a huge difference between 5 minutes and 24 hours.
Right.